1.
All right. Hi,
So,
today we're going to be talking about long QT syndrome, which is a syndrome associated with the cardiovascular system. And this is by me, Sean Cowie, and Jeff Kayak. So, it's just a breakdown of the symptoms and characteristics. So, long QT syndrome is a heart rhythm disorder associated with the prolongation of the QT interval. This means it takes significantly longer for your heart to beat again after each beat. Some symptoms include fluttering in the chest, shortness of breath, fainting, and even cardiac arrest, although fainting is the most common. So, long QT syndrome can be congenital and be inherited at birth. It can develop later in life, or it can be a side effect of over-the-counter prescription drugs, and that's actually fairly common. A medical provider will diagnose it with an ECG, like the main thing, and also take a complete medical history to see if you have any sort of genetic component or lifestyle factors that might affect it. And it's very visible on the ECG. As you can see here, this is a regular QT interval. And then in the next slide, we're going to go over what it would look like when it's prolonged. And this space is between each contraction of the heart, of each heartbeat. So the physiology behind long QT syndrome is essentially an imbalance of ions within the heart tissue. We know that sodium, potassium, and chloride in a very complex way affect the heart and the pacemaker and why it beats. But overall, the prognosis for people with long QT syndrome is good. Most survive. Only 4 to 5% result in death. And it's treated with something called beta blockers, which is a prescription medication that blocks the effect of adrenaline on the heart. And there's the person that just fainted.
all right. So right now we're going to compare the EKG or ECG of a normal one and a person or one with a person who suffers long QT syndrome. So the main difference between the normal and the long QT is the elongated S and T segment. However, the QRS segment doesn't show much of a difference as much as the S and T segment. Still, the QT interval is the one that's being elongated, and that's why it's called long QT syndrome. And that's the main difference for today. And thank you all for looking at our presentation.
Thank you.